And then you put a lubricant. Lubricants, actually it depends on you lah. You nak letak ke tak nak. If you don't want, then no need lah. And then you insert the speculum. How you insert? Here they taught you insert vertical and then turn horizontal. And then
tak nampak apa.
Okay.
Sorry.
You insert vertical, and then as you go inside, you turn horizontal, right? It doesn't matter how you want to insert. Whether you straight, you want to insert like this, also no harm. Except for your patient lah, suddenly feel discomfort. Or the best way from the video, the best way is you insert obliquely. Oblique. Ini kecil sangat so you cannot open. So oblique, and then you turn. As like, for example, like 3/4 of the speculum blade, then you open. When you open, if you see, if you cannot visualize your cervix, you withdraw a little bit. Withdraw, and then you go further. You withdraw and then you go further. You press and then you go further. If you still cannot see, you try to do it again. Withdraw and then go, press and then go. Nampak tak? Lepas tu you press and then you open. If still cannot see, you try to ask the lady to put both her hand under the sacrum, or maybe put pillow, so that it will tip the pelvic a little bit. So after that you open, and then you, as you can see the cervix, you inspect the shape, any pathological like polyps or scar or ulcer, any hypertrophy, any bleeding, gently insert, because if a presence of ectopic pregnancy or maybe endometriosis, if you go very rough, then it will cause bleeding. So very gentle. Any inflammation or any discharge. And then from this speculum examination, you do normally 2 tests: high vaginal swab and also pap smear. High vaginal swab, you use this one. Cotton tip swab and the tube. Cotton tip swab and tube. How you do it? This one normally you do it in the patient presence of any leakage, any discharge or any excessive mucus. So you want to take this one for culture. So how you do? Let's say this is the cervix and then this is the fornix. You go like outside. Not at the cervix, outside. Do circular motion, 360-degree motion. And then you take this one, you open the tube, put inside, send for culture. Okay? Macam nak tutup ni? And then the next one is pap smear. Pap smear, we did our own pap smear. So cute. This one actually it's the same thing lah. This one and this one. Okay. This one normally you use for post-menopause period. Normally in Malaysia they don't use lah, because normally the patient come normally in reproductive period. Okay. Cyto brush. This one is cyto broom. This one is separate pap smear kit lah. This one normally in reproductive period. Cyto brush and spatula. How in spatula? How you do? This one you have to do during your houseman kan. You take cyto brush, and then this one is for endocervix. So you insert inside your cervical canal, then you do 360 circular motion. 360 motion, degree rotation. And then this one take slide. Only to half part of the slide. for ectocervix, so you do the same rotation 360, and then the other half of the side, okay. So you take fixator. Normally in Malaysia they use spray. This one is artificial fixator. So you fixate the smear, like serazu lah, serazu. After you put the smear, serazu fixate the spray, and then let it dry, and then you send for lab lah. The same together with the high vaginal swab. And then you withdraw. You take out. You take out the speculum. When you withdraw it gradually, you need to inspect the vagina, the color of the vagina, whether presence of inflammation. So you withdraw carefully, slowly, and then check for the vagina. Okay. Okay. So you after that you close.
Tak payah, just buat.
Just keluarkan sambil tutup. Sambil tutup lah.
Tak payah oblique ke apa lagi, right?
Tak payah. Sebab dia memang dah terbuka. Withdraw. Let's say lah, ni one tactics lah. Let's say if the patient is obese, so all the fat tissue compress the vagina, so you cannot see. How you want to do? How you want to insert the speculum? You take gloves and then you potong kat sini. So it jadi like sleeve, right? Ni dah potong kan? Ni dah potong punya. So you dah potong, then you take your speculum. You must insert at the sleeve you did. You already cut lah. And then when you open, you insert, and then when you open, it actually compress all the fat tissue.
Without injury.
From the side, so you can the cervix is visible lah. Well, okay. That is speculum. Lepas tu apa? Manual kan? Lepas tu, and then the manual examination. Can see it? Cannot eh?
Can.
They cannot see it. For manual examination, you lubricate your index finger and middle finger. So you insert first. You insert one finger. Normally middle finger lah. So you insert, and then you press. You press the downwards to the sacrum. Okay. Then only you insert another your index finger. Can see ya? Because you press first because in anterior wall there presence a lot of nerve, so you don't want to irritate the patient. So you press first. You insert your middle finger, then you press, then you insert another one. It actually depends whether you want to insert only one finger or two finger. Doesn't matter. Up to you. If you want to feel all the organ well, then you insert two finger lah, so that you can feel. If you feel the patient is uncomfortable, then you insert only one finger. Okay? And then this is my manual lah. After that, you do bimanual examination. Bimanual examination is you take another hand, the abdominal hand, you press downwards, sweeping movement. You press the pelvic organ towards your vaginal hand. So the abdominal hand press, and you can actually move your vaginal hand upwards lah. So you sentuh. So you can feel all the if presence of mass, then you can feel. And then if presence you want to estimate whether the patient is having anteverted or retroverted uterus. So you do sweeping movement, and then after that, your point is anterior superior iliac spine, and you move your hands slightly lateral for adnexa, the ovary.